Next, we'll hear from Moda. Please begin by introducing yourselves and explaining your rate request. Thanks, guys.
Very good. Sorry about that, jumping the gun there. Again, I'm Mark Dambrick-Wild, Director of Actuarial and Underwriting for Moda Health Plan.
And I'm Craig Anderson. I'm Senior Vice President and Chief Actuary for Moda Health Plan.
And I'm going to share a presentation to walk us through this. I have one presentation which includes both individual and small group, and I will pause as we get to the end of the individual section of the presentation for the division to respond to that filing before moving on to the small group presentation. I assume that that's the way that y'all would like that to operate. And is my screen showing? Yes, okay. Thank you. So for the individual filing, we have a approximately just under 20,000 subscribers as of June who will be impacted by this filing, almost 28,000 members. The average increase is 3.9%, but that does vary a little bit by plan design and geography, so that there's actually a range of increases that members will see that vary from a negative 3.5% to a positive 8.5% impact, but on average 3.9% based on our member mix as of the time of the filing. We made a significant number of plan modifications. However, the driver of these plan modifications were predominantly to stay in accordance with the update to the AV calculator for 2024. We also made the revisions to the Oregon standard plans to stay current with the proposed standard plans for 2024. And made adjustments to stay in accordance with Senate Bill 1529. So I'm not going to otherwise go into detail about the plan modifications on this slide, but can refer everyone to the filing itself for additional detail if desired. We are not offering any new plans for 2024, nor are we discontinuing any plans for 2024. For the HSA plan designs, we are making adjustments in both of them. These plan designs have the same deductible and out-of-pocket. In other words, in 2023, once the member reached $6,900 worth of deductible, they had also reached their out-of-pocket and had 100% coverage. For 2024, that number will rise to $7,500 for both the Beacon and Affinity versions of the HSA plan design offered in the individual market. We did make one significant network change for 2024. We are offering the Affinity network in Deschutes County, something that has not been available for the past couple of years. So that is the primary expansion of one of our networks. We have 17 plans available on the Beacon network, which is sort of in the northern I-5 corridor and down the gorge a little bit and in the southern Oregon area. And then Affinity covers the rest of the state where Moda has individual plans available. Some rating areas are split between the two different networks. So, for instance, there are a couple of counties that are in Area 7 that are part of Beacon, and most of it is in Affinity. And likewise for Southern Oregon, there's some in Beacon, some in Affinity. But the only significant change was bringing in Deschutes County as a part of the Affinity network. And I believe that is the full overview from what I had on the individual filing.
Thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision. Oh, I'm sorry. Actually, do you want to do small group next and then Michael, how would you
Either
like?
way, I assumed that you would want to address each of the filings separately, and so I'm happy to let you discuss the individual filing first, and then proceed on with the small group portion.
Sure, if that works for you.
Hi, everyone. My name is Drew Bucks, and I'm an actuary for the division and the primary reviewer for the Moda individual filing.
My name is Tasha Sizemore. I am the Life and Health Program Manager.
Hi, TK Keen. I'm administrator with the division.
Hi, I'm Kirsten Anderson. I'm a deputy administrator with the division.
Okay, thank you. For my presentation today, I'll go over the actuarial review we performed on the 2024 filing. And so I'll start with the high-level overview of the review process, and then I'll mention some of the factors for 2024, and then I'll wrap up with a recommendation for this filing. And so as Mark just mentioned, the individual rate request for 2024 was 3.9%. The overall market range was from 3.5 to 8.7. And so now I'll go over our review process to evaluate that request. And so we focus on three categories: data and experience, assumptions, and calculations. For each category, we're looking for appropriateness and reasonability. So for data and experience, this is what the company uses to project what they expect for 2024. The company uses the most recently completed full year of data, and that was from calendar year 2022, and this serves as the base period. One thing that we consider for this data is the credibility and how reliable the data being used to project from 2022 to 2024 is. And so for Moda, this was fully credible. Next category is the assumptions, which are used to adjust the base data period data from 2022 to the projection period 2024. And so this includes trend, reinsurance, risk adjustment, morbidity, changes to demographics, and others. One of the most important assumptions here is trend. And so this is a projection of the medical inflation or cost utilization as well as RX. So we reviewed this for the company itself and compared it to other carriers. The company's trend factor was 6.9%, and the market just above the market average of 6.6. Last of the three parts I mentioned are the calculations. Calculations, again, take the 2022 data and the assumptions to create the 2024 rates. And so after a review of these three categories, we had no issues with these three parts. And so now I'll talk about a couple important factors that came up for 2024. The first being the basic health plan or Medicaid redetermination. And throughout this process, we determined that while this starts in July of 2024, we feel the bigger impact will be felt in 2025. Another one of the factors is Senate Bill 1529, which required carriers to cover 3 PCP visits at $5 copay. The next one is labor disputes related to post-COVID care delivery, coupled with increased member utilization. The last two are GLP-1 drugs and COVID. And so the company has taken all of these into consideration, and we found no issues with any of these. And so after a review, which I've just gone over, we propose to approve as filed. Thank you.
All right, Moda, do you have anything to add on your individual filing?
We do not.
All right, why don't you go ahead and present on small group then?
Will do. Thank you. So for the small group filing, this is a somewhat smaller block for Moda Health Plan. We have just under 700 groups as of June 2023, just shy of 4,000 subscribers, just shy of 6,000 members. We filed for an average increase of 2% on this line of business, and as with the individual filing, that results actually in a range of increases based on changes in plan relativities and area factors. In this case, the range goes from almost -2 to just over 7%. So As with the individual filing, we made a significant number of plan modifications. And again, these were primarily done with regard to staying in compliance with the AV calculator updates for 2024, staying with the updated 2024 versions of the Oregon Standard Plans, and complying with Senate Bill 1529. There are a couple of new plan designs and one discontinued plan design for this line of business. We are introducing new silver plans on both our Connexus and Moda Select network. The plan design is identical for each, but just for the different networks, and discontinuing one high deductible health plan that had been available on our Connexus network. For the HSA plans, we again made a fairly substantial number of changes in the high deductible health plans that are available in the group market, but not going to read through this slide for you. I leave it here for a moment and for people to absorb, but predominantly these were changes to stay in line with the AV calculator and updated IRS regulations. There are no network changes on the small group side. We have 21 plans available on statewide basis for our Connexus network, 2 platinum, 7 gold, 8 silver, and 4 bronze. And we have 13 plans available in our Moda Select network, which is available in the Portland metro area. Well, not quite area 1. Does not include Yamhill County. 1 platinum plan, 4 gold plans, 6 silver, and 2 bronze plans available on that network. And I believe that is the final slide I have on the small group rate filing.
Thank you. Division staff will now lead a discussion about the review of that filing and preliminary decision.
Thank you, Ethan. I won't go into detail as much as I did for the individual. A lot of this is the same in terms of our review process. But starting with the rate request, the Moda's rate request was 2.0%, and the overall market range was from 0 to 12.8%. As I mentioned, the process is similar in terms of looking at the data, the assumptions, and the calculations, but the data and assumptions are obviously specific to small group. One factor I do want to mention again is trend, since this is the biggest factor involved in increases. The market overall for trend was 6.6%. Again, Moda's trend was 7.1%. Both of these are much higher than the request itself. After the review, again, which I've just gone over, we propose to approve as filed. Any questions?
All right, Moda, any additional information or comments you'd like to make at this time?
No, thank you.
All right, the division will consider all information before making final decisions on these filings. We will now take any public testimony. Please unmute and introduce yourself. All right, it looks like no one signed up to testify, so let me remind everyone listening that today, August 4th, is the last day for public comments. Comments can be submitted through our website, www.oregonhealthrates.org.